My name is Dr. David Fantarella. I practice in North Haven, Connecticut. I've been practicing for about 16 years. I do general implant and laser dentistry, both hard and soft tissue. Periodically, technology comes out that when you really integrate it, you realize that you can't practice without it. Isolite was something I had my eye on for a while, but so there became a time where I needed it to do some filming of laser dentistry, and I knew it was perfect for it. So I sought it out at one of the dental shows, picked it up, and never looked back. Dental isolation is an absolute must. If you want good patient outcomes, if you want your dentistry to last, if you don't want failures, if you want your patients to have an easy experience and leave and say, you know what, that was easy, you have to be able to isolate and control the environment. Isolate controls the environment. It's really that simple. If you can't control the oral environment when you're doing procedures, the patient outcome is not as good. Absolutes are very dangerous, but I will tell you that I pretty much have a 100% success rate with Isolate. So in every operative procedure and crown prep that I do, I use Isolate 100% of the time. It's kind of a joke that the reason I bought Isolate was so that I could get rid of my staff, which is not true. It allows my staff to do their jobs, which is assist. And I have it in all my operatories, and I haven't integrated it in the hygiene operatories, but that's definitely the next step. There's a huge hygiene application for it. I would say my single favorite thing is controlling the floor of the mouth and the tongue. It provides a bite block so that patients don't have to struggle with opening. Most patients don't realize that. They think opening is the easy part. It's the hard part. It's easy to close. It's hard to open and stay open. You get fatigued, so you have your bite block. We have burrs going 2 to 400,000 RPM. We have sharp instruments, we have acids, we have bonding agents. We got all this going on in a very small area. It obturates the throat so it doesn't pass out of the mouth into the oral pharynx. It provides light, it provides passive suction rather than high volume suction that causes a lot of sensitivity. And with lasers, I do a lot of non-anesthetic dentistry. So if you can have passive suction, that again adds to the patient experience. We also had an incident in the office where a patient's floor of the mouth had gotten nicked by the handpiece, and the floor of the mouth gets torn, and then it has to get sutured, and Isolate prevents all that. So that's the same feeling I have when you're working on that lower second molar, when you know that the patient's about to swallow and the floor of the mouth's going to come up and the tongue's going to come over, and not only is it going to interfere with your bonding, but you might hurt them. So I don't worry about that anymore. It's controlled entirely with Isolate. Don't practice another day without it. Do it today. It's that simple. Just get it, integrate it, and don't look back.